Bismillahirrahmanirrahim. I'm Dr. Amir Zaheer. I'm currently working in Mukhtar Sheikh Hospital as a head of surgery and as a general and colorectal surgeon. Today, I'm going to discuss with you some points about colorectal cancer. Colorectal cancer, और जिसे हम बड़ी आंत का कैंसर भी कहते हैं, this is the third most common cancer overall in Pakistan. The colorectal cancer, unfortunately, now is affecting younger generation as well. Fortunately, colorectal cancer, if diagnosed in time, has a very good outcome. Patients come to us with symptoms of bleeding in their bowel movement, pakhane mein khoon aana, change in bowel habits, pain in their abdomen or feeling swelling in their abdomen. Sometimes they present with simple complaints like loss of appetite or loss of weight. There are two ways in which we can diagnose colorectal cancer. The most common way of finding this cancer is when patients are referred to us with complaints, as I mentioned before. In these patients, we run certain tests, and as a result of that, we are able to diagnose colorectal cancer. The most important of these tests is a colonoscopy, which is a camera test. The other way is that patients who do not feel any symptoms, we put them through the process of screening, and this allows us to diagnose colorectal cancer in their early stages even. In screening process, we basically run certain tests in healthy population in order to diagnose a certain disease. So in case of colorectal cancer, screening involves certain tests like camera test of the large intestine, जिसे हम camera test कहते हैं बड़ी आंत का, or certain tests in your stool which can help us in diagnosing colorectal cancer even when you're not having any symptoms. There are no certain set guidelines for screening bowel in Pakistan. However, the cases that we see, we will advise that you should have a colonoscopy, a once-off colonoscopy at least after the age of 45. Certain group of patients are high-risk patients, and in these patients we advise to have colonoscopy at the age of 45 or by the age of 50. These patients are patients who have family history of bowel cancer, or patients with bowel disease like IBD, or high BMI patients. Once we diagnose colorectal cancer in our patients through colonoscopy, we run a series of tests. These tests are done to stage the colorectal cancer, and based on stage we decide what is the best treatment modality. Surgery is the best way of curing the disease. Alhamdulillah, at Mukhtar Sheikh Hospital we have established first of its kind colorectal service in South Punjab. We have done numerous colorectal cancer cases over the years, and Alhamdulillah, most of them have been done laparoscopically. I would advise all my listeners that you should visit the nearest gastroenterologist or a colorectal surgeon in case you experience any of the symptoms. And if you are one of the high-risk patients and above the age of 45, you should opt for once-off colonoscopy as screening. Thank you.